Thank you all for attending our focus session today on campus crisis prevention and preparation. I have to share with you the Professional Development Day planning team had a very difficult decision in terms of removing one of the MCC mini conference sessions from the afternoon because it has been so popular. But the team really felt that it was absolutely essential that all of you have the opportunity to hear the information that we'll be sharing with you today in terms of what we as a college are doing to prevent a crisis from occurring on campus and what you can do to help, and also how the college is prepared to respond in the event of a crisis. To start out today, what I'd like to do is simply present a very brief overview of some of our efforts in terms of both crisis prevention and preparation. First of all, one of our greatest strengths is our continued collaboration with local agencies, including our first responders like the Crystal Lake Police Department, but also with mental health professionals in terms of family services and the McHenry County Crisis Line. We've continued collaborative efforts with those agencies, and that strengthens our ability both to prevent crises from occurring, but also response efforts if a crisis were to occur. We became one of the first Illinois community colleges to implement a mass notification system in the spring, and we conducted our first test this fall. We've completed installation of telephones in all classrooms. We will be installing video surveillance cameras in the parking lots in the spring, and this will be made possible by a federal earmark secured by Congressman Manzullo. And really, the impetus for this effort was requests from students. There was an MCC student security survey, and the overwhelming response from students was that they wanted surveillance cameras in the parking lot. So this is in response to our students' request. We currently have an action team exploring digital signage, so ways that we can use monitors in hallways and other locations to communicate in the event of an emergency. And we continually invest in our employees in terms of both training and professional development, again, to prepare to respond to a crisis and to help prevent a crisis from occurring. And Leslie will be sharing much of what she has learned in terms of anger management and crisis prevention strategies with you this afternoon. And after she presents what she's learned, yeah, she'll prevent it too. Harriet will be sharing with you who to call in the event of an emergency, so what to do if something does occur on campus. And then I'll be sharing with you plans that we have to communicate with all employees and our students in the event of a crisis. And after that, we'd like to leave about 15 minutes for questions, so be thinking of questions as we go through our presentation today, and we'll have time afterward to address some of those questions that you may have.
All right, no pressure. I'm going to prevent things here today, I guess. I'm Leslie Frederick. I'm the Dean of Students here at MCC, and I don't know a lot of the new faces I saw today. I don't think I've met you yet, and maybe that's a good thing. A lot of times I meet people initially through reports through the student conduct system and things like that, and that is one of my roles here on campus, is to work with student conduct issues, and then also I've been very active and involved with kind of doing more preventative kinds of things so that we don't end up with high-level disciplinary issues, that we have ways to prevent those and be, I guess, more preventative, not to be repetitive, but to be more preventative in nature so that we can be developmental with our students. And I used this, in fact, all of last year, throughout the year, we did a number of presentations through professional development for our faculty and staff here at the college on ways to work more effectively with students and be preventative in nature rather than waiting until things escalate to the point where they become a judicial matter. And so we're continuing that effort. We did some work at the faculty in-service back in August, and I talked a little bit about behavioral intervention at that point, and I used this slide to kind of illustrate the behavioral intervention continuum, if you will. And the first part of that is really the preventative piece. How do we identify behaviors early so that we can provide support and whatever resources the students may need to resolve the issues early so that they don't end up in a campus crisis potentially, where then we're using our crisis response mechanisms, some of the things that you'll be hearing about in just a little bit from Kathleen, to respond then to those crises. So we're trying to do more things on the front end of the red line, be preventative, in nature rather than having to use our other kinds of methods to be responsive to crisis if it occurs on our campus. But we are prepared in the event of a crisis, and we'll talk more about that. So again, we're trying to focus on prevention here at MCC, and one of the things that we're doing is implementing a behavioral intervention team. It's hard to say sometimes. And this is a common model that's being implemented across the U.S., and after the Virginia Tech shooting that occurred, there were many commissions and studies and things that came out of that, and one of the consistent recommendations was that colleges need to have a behavioral intervention team. They should have, or it would be nice, but it is becoming more and more standard for colleges to have those kinds of response mechanisms in place. Or not a response, but a prevention mechanism in place. Right now, many community colleges throughout the U.S. and in Illinois are without behavioral intervention teams, and they're, like us, in the infancy of creating that behavioral intervention team on their campus. Right now, we're in the process of reviewing best practices to determine what's going to be the best model for us here at MCC. Again, just to kind of touch back on the purpose of behavioral intervention, again, we're trying to be responsive early on to the needs of students. We want to be developmental in nature with students. We want to provide more accountability. So we want to not just say, oh, you're having a bad day, but we want to hold students accountable for their actions, but at the same time provide them the resources and support they need to deal with whatever issues that they may be experiencing. One point I want to make here, though, is that one of the questions that I get a lot of times is, well, do I report everything, or what are we trying to do here? The behavioral intervention team, once we kind of get that up and running, and the reporting that occurs now, is not intended necessarily to replace effective classroom management. People still need to manage their classrooms and their offices in effective, productive kinds of ways. But when students are experiencing issues, then the behavioral intervention team is a resource that can then help connect those students to the appropriate resources here on our campus. Again, the advantages of a behavioral intervention team are addressing behaviors early. Again, if we get on the front side of behaviors and we know what the issues are, we can connect those students with resources so that students don't escalate into behaviors that can become a crisis. Again, with the BIT, we can identify expected and appropriate behaviors for our students. Again, I'm a big proponent that it's not unfair to tell students what is expected of them and hold them accountable for their behaviors. That helps them learn. It's part of the developmental process. And it also helps us document patterns of behavior. And again, as it relates to particularly the Virginia Tech shooting and in other kinds of campus incidents, we've learned that without documentation, there are silos of knowledge. People may not have the connection to thread together all of the different incidents that are happening on a campus related to a particular student. So by having an integrated behavioral intervention team, it's kind of a repository for different kinds of behaviors so that we can connect those threads and see patterns of behavior and have documentation related to that behavior. This slide represents a common model for a behavioral intervention team. And you'll see there's an inner core and an outer core. And again, we're still exploring best practices and models, but common models include the inner core of a dean of students or whoever the primary judicial officer is on a campus, a faculty member, and a mental health professional. And then the outer core would include folks like campus safety, our special needs department, the counseling staff, advising, the Crystal Lake Police Department, crisis services, family services. It could be a whole host of other individuals on our campus. And those folks would be brought into the inner core kind of on an as-needed basis depending on the kinds of information that's being reviewed by the behavioral intervention team. So again, as we're focusing on prevention, one of the things that I like to say is effective prevention strategies are like a good neighborhood watch program. Everybody has to be part of the solution. It includes timely reporting and accurate documentation. And again, that's one of the things for those of you that I have worked with through reporting is that I always ask about the documentation. Documentation is key in terms of helping connect the dots and identifying patterns of behavior.